Disability Squeeze. I'm really glad you're here. Today's episode is one I've been looking forward to. Dr. Matthew Boris is an assistant professor at the Binghamton University Department of Social Work and an expert in disability policy. He's worked across the field as a frontline social worker, a health educator, a policy analyst at the U.S. Department of Health and Human Services, and as a grassroots organizer. In today's conversation, we talk through a recent piece Matt wrote that identifies 4 key areas of disability policy to watch over the next 4 years with the newly installed Trump administration. It's a helpful roadmap for anyone trying to make sense of where things might be headed and what to keep an eye on. So welcome to the Disability Squeeze, Matt.
Thanks, Zach. It's great to be here.
One of the things you wrote about in this piece is that there's no single Department of Disability policy. I thought that was an interesting fact that you pointed out. And so policies affecting disabled people are scattered across different agencies with different definitions and priorities. So with that in mind, why did you choose to highlight these 4 areas in particular, and what should listeners understand about the moment we're in?
Sure. And yes, as you said, disability policy is really kind of spread across the government and often does define disability in very different ways, and often in ways that kind of contradict each other, which can create real catch-22s for people who are trying to deal with it. I chose these 4 areas, which are workplace disability rights, cuts to the federal workforce, education, and healthcare, as 4 areas where, as I was writing this in the first month of the administration, I saw particular threats that were either already unfolding or that seemed to kind of be waiting in the wings based on things that we had seen proposed or had seen written in policy documents like the Conservative Blueprint Project 2025. And I would have really liked to have been wrong on some of these. Unfortunately, several of them do seem to be true. And I will say that, in fact, as I was writing this, I wrote the first draft shortly before the inauguration, and I kind of kept having to update it because there would be something new. There would be an area that I hadn't entirely considered, or where I'd spoken to advocates and they said, well, we don't think that'll happen for a year or two. And in fact, there were signs that it was happening sooner.
Right. A lot happening, and it's hard to keep track of how to follow it. Can you just a little bit about your background. What were you doing for the federal government?
Sure. So before I returned to academia to complete my PhD, I worked in the Department of Health and Human Services, it's a very large department. I believe it's currently 82,000 people, though there was actually a headline today that the new secretary is hoping to cut 20,000 positions from it. Within that, I was in the Administration for Children and Families, which is more the human services part. It's the agency that does things like poverty policy. Again, we don't say poverty, we say think of the children, so it's the Administration for Children and Families. And it runs programs like TANF, which is what remains of welfare, Head Start, low-income heating assistance, child welfare programs, a real range. Within that, I worked in their evaluation office, the Office of Planning, Research, and Evaluation. Did a whole lot of work to evaluate how programs were running, who they were benefiting, how they could be run better. This is the type of office that has been seeing a lot of cuts, unfortunately, which is a real loss because they create very important research that, if we think that programs can actually benefit people, gives us information that we really need. If we kind of take it as a given that programs are useless, then I suppose we don't need offices like that.
All right. So you're coming at this from a perspective of someone who has worked within these federal systems that you're talking about, have evaluated them, and have done a PhD studying them. And you arrived at these 4 key areas. And so let's start with this first one that you highlighted in your piece, which I'll link to below in the podcast.
Sure. So the basic legal framework here, the Americans with Disabilities Act, has been law since 1990, and the Trump administration has made no moves to overturn that. That said, the Americans with Disabilities Act provides sort of conditional protections. It guarantees that an employer can't discriminate against you by refusing to provide reasonable accommodations for a disability. But what is reasonable can be subject of a lot of debate, both in sort of formal laws and regulations and in the everyday process of navigating something with a boss and not wanting to be seen as too much of a complainer or demanding too much. And in my research, I talked to a lot of people who were really finding it difficult to walk that balance. This included people who worked for disability-focused organizations who would say, well, I don't want to ask for that because I think that it might just not be worth it. Or I know that I could file a complaint, but that would be a lengthy process and I would burn all my bridges at work. So that said, the general attitudes and people's willingness to consider workplace accommodations can vary a lot with the political climate. And the Trump administration has signaled very clearly that they want to change that political climate.
How can they change the interpretation of reasonable accommodation of the ADA?
There are various things that they can do. At the federal level, they can reduce or get rid of the workforce that actually processes disability claims within the Justice Department and within other departments. They can go after offices that are focused on accessibility, and people have probably heard about the cuts to DEI, to diversity, equity, and inclusion programs. Those cuts, and this was actually a surprise to a lot of people, myself included, also included accessibility programs. And so people who worked in federal departments whose focus was on trying to improve accessibility found that their work was now suspect or in some cases no longer wanted, and people were in some cases let go. There's also a less tangible but still very important impact on kind of general attitudes. And there we've seen that Trump has been willing to use his position as president to suggest very clearly that disabled people shouldn't be in certain jobs. The most, I think, stark example of that came just in the first weeks of the administration when there was a plane crash outside Washington, D.C. that killed 67 people. The president, without any evidence for this, said that the cause of the crash was unidentified disabled workers at the Federal Aviation Administration. He actually kind of rattled off a list of disabilities that, in his opinion, meant that people didn't have the special talent necessary to work at the FAA. There was no basis for this. There was no information on what had caused the crash at that point. But the willingness to kind of immediately say, oh, well, this must be because we're hiring disabled people is something that risks making a lot of disabled people in the workforce less willing to kind of stick their heads up and ask for an accommodation. And if a boss doesn't really like making accommodations, this is essentially the president saying, yeah, I'm with you. You can kind of discriminate against these people. They shouldn't be here anyway.
You're identifying both judicial and administrative potential avenues for increased discrimination and also attitudinal attitudes, increasing reasons for potential increased discrimination against disabled people in the workforce that could be happening. So you'll watch very closely. What measure will you look at to see if we see more discrimination in the worker? How can we follow this?
It's a difficult thing to follow. Data is limited. There are reports that come out each year on the Institute for on Disability at the University of New Hampshire puts out one that I tend to look at that does study disability employment rates, that does study what's called the employment to population ratio, comparing that for disabled people to non-disabled people. And to be clear, it is already very stark. There are major gaps around employment by disability. It will be interesting to see if that comes out. I think that at the policy, or if it'll be interesting to see if there are changes in those rates. It may be hard to tease out because there may be major changes happening to the economy in the coming months.
Right. I was going to say it'd be difficult to pinpoint.
Exactly.
Yeah.
One other place to look, there are a number. I mentioned offices like the Access Board, which is part of the federal government, as Elon Musk's Department of Government Efficiency, as it's called, goes through and shuts various offices. It will be interesting to see if the Access Board both maintains its staff and even continues to operate, just as we've seen DEIA officers dismissed elsewhere in the government. One important note is that the federal government has, during Trump's time, been rescinding the ability for federal workers to work at home. For a number of disabled workers, the opportunity to do remote work, at least some of the week, has been a huge benefit of the last 5 years that has allowed many people to work and also to work at reduced cost. Getting to the theme of this podcast, has reduced some of the very costly and burdensome elements of getting to and from, especially in, if one needs a specialized vehicle or something like that. The move away from remote work in the federal government and potentially the move away from remote work elsewhere in the economy following the federal lead really does pose a risk to a number of disabled workers. And it'll be interesting to see even looking at the number of disabled people in the federal workforce, because the federal government has been among the top employers of disabled people for a long time because of
Yeah.
various programs, it'll be interesting to see if those numbers in percentage terms go down. We're obviously seeing a lot of cuts to the federal workforce in general, but
Right.
disabled workers
Yeah.
may take a
Uh,
particular hit.
let's move to the federal workforce, your second area that we should be focusing on. So, what should we be looking here?
So this overlaps a little bit with what I was saying about telework, but this looks more broadly at the federal workforce itself. Um, one of the Trump administration's goals is to drastically shrink the federal workforce. Um, this is, generally justified by the idea that it is too large, that there is waste, et cetera, et cetera. That said, the fact is the federal workforce as a percentage of the US population has been flat for years and has been through a number of previous rounds of cuts, particularly during the Clinton administration, actually. As a result, there are a number of programs, particularly public facing programs, that are frankly understaffed. And some of those are programs that serve disabled people directly. Probably the biggest example, and the one that's in the news most currently, is the Social Security Administration. Now, Social Security has usually been seen as a somewhat untouchable program. When I was teaching my students policy in the fall, I said Social Security, it primarily serves retirees. It's generally seen as something that's earned. Politicians don't want to mess with it. What we've seen over the past couple months is that maybe that wasn't entirely true. Trump administration, and specifically the team led by Elon Musk, has been pushing for major staff cuts at the Social Security Administration, as well as the closure of offices. The result of that is basically to take a process of applying for benefits, of updating forms, of getting questions about pretty complicated disability programs answered, and making it move slower because there are fewer people to answer those questions. This is a process that both researchers like myself and government agencies like the Government Accountability Office, which reports on these things for Congress, have identified for years as places where things move too slowly. People's wait
Right.
times are too long. And by reducing the number of people working there by thousands, those wait times are likely to get even longer.
So, I want to highlight the specific thing, which is the closing of field offices. But there's some really interesting research here, I think, that can tell us what happens when you close a Social Security Administration field office. By a paper that I can cite by Manasi Deshpande and Yu Lee,
I
looking
had that
at
paper in mind, yes.
looking at the effects of field office closings on disability benefit receipt, and they found that the number of disability benefit recipients declines by 13% in surrounding areas, with the largest effects for applicants with moderately severe conditions, low education levels, and low pre-application earnings. Right. So when you close these offices, it means people who should be getting these benefits are less likely to get them. Right. I think that's the takeaway for me. And so here you kind of have a hidden form of retrenchment. Can we call it that? Right? You're not
Absolutely.
changing the rules of entitlement or eligibility, but you're making it more difficult for people to get on disability benefits. Is that how you
Precisely.
see
You're
it?
you're making it more difficult for people to get on disability benefits, and in some cases, you're making it more difficult for people to keep themselves in line with program rules, which can result in the loss of benefits. There is the mechanism that you laid out. Um, a lot of the folks that I spoke with in my research talked more about being on the phone and being on hold waiting for hours and sometimes having to hang up because they had to go to the bathroom or they were too tired and they had been waiting for so long. And these were folks who were already getting benefits but wanted to make sure that they were doing things properly or wanted to or had gotten a little bit of income from some source and wanted to make sure that they were reporting it correctly. The rules around supplemental security income and Social Security disability insurance, which are the two main Social Security disability programs, are really complicated. And people are kind of trying to make sure that they don't run afoul of them because that can mean, potentially being told that you overpaid and now you have to pay a lot of that back. The folks I spoke with in 2022 and 2023 already talked about waiting on and hold for a long time than speaking to a somewhat anonymous phone service operator. And now we're talking about having even fewer of those. And that
Right.
is for applicants, as you said, as well as for current beneficiaries. And it is essentially a way of rationing services. The concept that comes to mind is what Don Moynihan and Pamela Hurd call administrative burden. And as they say, that is a form of policymaking by other means, by increasing the administrative burden on people who either want to apply for or stay on a program like SSI or SSDI. You make it more difficult and you likely decrease the number of people who will actually get benefits.
Right. So these reductions in the federal workforce, your expert opinion is that this will result in more people falling through the cracks.
Absolutely. And that I think that there's no question this will result in more people falling through the cracks. And I think that that is likely by design. I don't think that it's actually conspiratorial to say that making a program harder to access is something that you can do if you want to have fewer people get that program. We saw that very much in the welfare reform of the 1990s as we moved from cash assistance in the form of what was called AFDC to temporary cash assistance in the form of what's now called TANF. It became much more difficult to get benefits, and so far fewer people got them. That's part of how policies are designed. And that seems to clearly be what's being done through these cuts to the workforce.
What's the possibility that the individuals who do not get on disability, given these administrative burdens, now enter the workforce?
I would say that most people who are applying for SSI or SSDI have already tried and are often already trying to enter the workforce. People in the US generally don't apply for public assistance if they have a lot of other options. And these are not particularly generous programs. SSDI, what it gives you is based on what you used to make, sort of like Social Security retirement. But a great many people on it are at or below the poverty line. SSI, the maximum benefit, which not everyone gets, is $963 a month. These are not generous programs. Many people I spoke with still try to do some work while they're on them, partly just to make ends meet. So this isn't a case of, oh, well, if this wasn't there, then people would just pick themselves up and get a job. I also do want to stress, this is something that you and I know, but to make clear to listeners, these are programs with some of the most stringent definitions of disability in the federal government to prove that you are disabled enough, which is frankly a term I don't really like, but it's the applicable one here, to prove that you are disabled enough to get SSI or SSDI, you have to prove that your disability prevents you from doing any work beyond a sort of very low minimum threshold. Um, and you have to provide medical documentation of this. You have to show that it has lasted or can be expected to last at least a year. This, people in many cases will have to come in every few years for what's called a continuing disability review to show that this is still the case. These are not programs that one can get on easily, and they're not giving you that much. The folks who apply for them generally really need them.
All right, let's move to your next area of attention with the new Trump administration around educational opportunities.
Yes. Well, when I wrote this, I said that there seemed to be signs that the Trump administration wanted to close the Department of Education. Since then, we have seen them publicly say that that is, in fact, the plan. They have laid off a significant portion of the Department of Education's workforce. Close to half of the people who work there um, have been let go. Um, this is relevant for a number of reasons, but the reason I point to it is that the Department of Education is the agency that's in charge of enforcing IDEA, which stands for the Individuals with Disabilities in Education Act. This dates back to 1974, I believe. Um, though it was under a somewhat different name then. And this is the law that basically guarantees that everyone, including students with disabilities, has the right to a free and appropriate public education. Prior to the 70s, that was not legally guaranteed at the federal level. Some states had programs, but what we now think of as federal education is a relatively new historical development. IDEA does mandate that school districts have to meet certain minimum standards. And as the agency charged with enforcing this law, as well as some other civil rights laws, the education department plays a very important role on behalf of students with disabilities. If the education department is being gutted through workforce cuts and eventually closed, the question becomes what happens to enforcement of this law? There are also various federal programs run through the Department of Education that do direct dollars to school districts based on a number of things, which can include the supports for students with disabilities. Again, you have the question of without the department, will those funding streams be directed elsewhere, or will they?
Paying for paraprofessionals in schools is, for example, would be one avenue.
I believe so. I will admit I don't entirely know
Okay.
the balance of how much of that is local, how much of that is state, and how much of that is federal, but I believe that federal dollars can play a role in there. So the question becomes, what happens with IDEA and the enforcement thereof? The best indication we have comes from Project 2025. Project 2025 proposes that funds for the Individuals with Disabilities in Education Act, quote, should be converted into a no strings formula block grant. And so I want to talk about that. Block grants are they're kind of one of these policy funding terms, and they're a structure by which federal funds, instead of going to specific places, based on, say, a formula of this many students who qualify get this, or districts with X percentage of students with this kind of need get that. A block grant basically gives a lump sum, usually less than was being provided prior to the block grant being created. That's not required, but it's how these things often play out. It gives that lump sum, and it often means that there is less federal oversight of how those funds can be used. Best example of this that I'm familiar with is welfare reform in the 1990s, where funds that used to go directly to low-income people as welfare benefits instead would go to states as a block grant, and states could do what they wanted with that money. And in fact, states ended up putting a lot of that money toward things like road repairs, or in the case of Mississippi, hiring NFL quarterback Brett Favre to give inspirational speeches. Block grants in many cases become slush funds. And so the proposal to convert IDEA funds into a block grant, into one that was specifically described as a no strings block grant, raises a lot of alarm bells about whether those funds will really be used to support students with disabilities.
So the critical thing is that you lose oversight of and federal perspective and guidance as to how these dollars should be spent, leaving it to the states to decide how to use their disability dollars. And the best evidence we have on block granting is from welfare, and the record is not stellar
The
in
record
terms
is
of.
not stellar. And in many cases, families, who are trying to support a kid who has disabilities often do have to kind of fight with school district. And not having the Department of Ed on their side, or not having as many people, in the federal government to play that role, whether they're in the Department of Ed or moved to somewhere else, suggests that those families will essentially have fewer champions at high levels and fewer people to turn to if their students aren't getting the support they need.
I wonder how this also plays into a larger, I think, Republican agenda towards charter schools and vouchers. And if you have any thoughts about how this might work out in that system.
I think that's a very good question. I think that, historically, um, because charter schools and private schools with vouchers even more so can select who is and isn't allowed in, students with disabilities are often those who are seen as not a good fit for the school, which essentially is a form of segregation. If a school can say, well, we don't want to serve any students with disabilities because that'll bring our test scores down, then that means that A, students with disabilities have fewer options, and B, they're concentrated in schools with fewer resources because often, the resources are going into the private voucherized or public charter schools. So yes, in many ways, this kind of fits into a larger agenda of defunding public education, and doing so in ways that are going to, harm those who most need it.
All right, let's move to the next category on this
On that happy
tour
note,
of on that happy note, healthcare.
Yeah.
What should we watch in the healthcare space?
So there are a number of areas to watch in healthcare. So let's start with the Affordable Care Act, better known as Obamacare. Passed in 2010, the Affordable Care Act has been a Republican target, since before it became law. One of the most relevant things to disabled people is that the Affordable Care Act prohibited insurance companies from either charging more or denying coverage based on what are called pre-existing conditions. Before that, if you had let your insurance lapse, if you were out of a job and didn't have insurance and you were trying to get back on, an insurer could say, well, actually, it looks like you're trying to get coverage for something that is a pre-existing condition because you already had that heart condition or that chronic illness or that, really any medical need. And that meant that in some cases, people just ended up having to pay more for their premium. And in some cases, an insurer basically wouldn't cover something. Prohibiting that kind of denial or differentiation of coverage is one of the biggest things that the Affordable Care Act achieved. It's a law that has a number of limitations that I have many critiques of, but this is one that really was a game changer for a number of people. And Republicans have made clear that they want to repeal the Affordable Care Act. A couple days before the election, the Republican Speaker of the House, said that his agenda was no Obamacare. So that is kind of first and foremost one of the things to keep an eye on. We'll see if they actually do propose an alternative. In 2017, in the first Trump administration, Republicans came, I believe it was one vote away in the Senate from repealing the Affordable Care Act. What
Right.
they
Right. Yeah, right, that history. And there are also the history in the debates where Trump talked about a concept of a plan. And I'm wondering if there's any more understanding of that concept right now and where we are with the administration. We're just a couple months in, and its potential impact on people with disabilities. Do you have any more ideas of where they're going?
uh, I don't.
Okay.
And the
Okay.
truth is, the truth is there are not concepts of a plan. There is only calls for repeal. Um,
Hmm.
the fact is the Republicans have had 15 years to propose an alternative that would still keep things like pre-existing condition coverage in place, and they haven't done so. Um,
Right. Because
yeah,
it's very unpopular. I think that's fair to say. It's
yes,
very unpopular to repeal those Affordable Care Act measures.
the idea of railing against Obamacare is popular. The actual things that the Affordable Care Act provides are themselves quite popular, and so
Right.
repealing them is very unpopular.
So, like Social Security, could we see here again another instance of increasing administrative burdens as a means to cut?
It's quite possible. There are also possibilities of making other changes sort of in the background. For instance, Project 2025 envisioned having two sets of insurance plans, one that covered people with pre-existing conditions and one that didn't. And this was framed in terms of creating more market choices. But again, kind of like the example of schools, it becomes another form of discrimination and segregation where people with disabilities can be dumped into the lower quality, this is for people with pre-existing conditions plans, and people who are currently healthy and don't have a history of any disabilities can be in the other plan.
Mm.
This is precisely the sort of thing that the Affordable Care Act attempted to address. But if it's framed kind of just in terms of a different way of regulating insurance markets, then it might have a chance of getting through and might be possible to do kind of quietly. We'll see.
This is kind of outside the ballpark question, but I'm curious to hear your thoughts on the Make America Healthy Again movement and its role and potential impacts for disabled people.
Yes, and I didn't write about this in my in my article, mostly because I ran out of room and because at that point uh there just wasn't really time or space to get into Trump's nominees. But this, you know, and I think that what exactly Make America Healthy Again means varies heavily because this isn't the kind of thing that is, put forward in a set of policy proposals. It's more, kind of a vibe or an aesthetic. But that aesthetic is frankly highly eugenic. What we're seeing from folks like the current Secretary of Health and Human Services, Robert F. Kennedy Jr., are pushes away from from vaccination, from a lot of forms of preventive healthcare, towards sort of a very vague eat healthy approach that isn't actually what it, when you look at, okay, what are you doing to promote healthy eating? You find that in fact, the Trump administration is cutting programs that would provide fresh produce to food banks and public schools. Instead, it's sort of, what I think we see is an attempt to um, treat health and health status not as something that government can try to promote, but as a personal characteristic to be rewarded or punished. And if you are healthy, then that means that you are virtuous and good. And if you are sick or disabled, that means that you have obviously done something wrong by not taking care of yourself. This is obviously, as I
Hmm.
said, it's very eugenic, it's very moralistic, and it's incredibly ableist. There are various elements of it that at times I've heard people say could be beneficial, but when you dig just a bit beneath the surface, they fall apart. One example is what I mentioned around healthy eating, when you see that in fact, access to fresh produce is being limited. Another example is that folks were saying that perhaps Robert F. Kennedy was good in wanting to take on chronic health issues, but in fact, the Department of Health and Human Services just disbanded its long COVID task force, which is, trying to address a prevalent and very hard to treat chronic health condition. Because in fact, it's not about trying to address current chronic issues; it's about treating the development of chronic issues as a moral failing.
All right. And what about Medicaid, Matt?
Yeah. So Medicaid is one of the most important programs in the US today for disabled people. It's a federal health insurance program that covers more than 74 million people. By various estimates, about 15 million of those are people with disabilities. And Medicaid costs a lot. And Medicaid does primarily serve poor and disabled people by definition. And so Medicaid is the target of lots of proposals for cuts. This is it's dangerous for a number of reasons. It's dangerous because it could mean people, losing their Medicaid coverage. It could mean people's Medicaid coverage covering less. Medicaid also plays really important roles in disability policy, particularly because it's the source of funding for home and community-based services. So for people who need the assistance of a personal attendant who can help them with kind of getting out of bed and getting off to work, who need services to live independently in the community, Medicaid is actually the funding source for those. Medicaid is also the primary funding source for long-term care, including nursing homes. And as such, it's Medicaid rules that set things like minimum staffing ratios at nursing homes. That's been a real issue. As you probably know, COVID-19 took a brutal toll, and some of that was tied to understaffing. And as a result
Mhm.
of longtime advocacy and the toll of the pandemic, under the Biden administration, there was a rule passed that mandated higher staffing ratios at nursing homes that receive Medicaid reimbursement. That's another thing that Republicans are eyeing for repeal, according to reporting. So there are a number of different ways that Medicaid is really kind of at the core of a lot of disability programs, and cuts to it or repeals of its regulations could have a number of devastating effects.
Matt, thank you so much for talking to me. This is so interesting. And, we need to keep paying attention and following this along. Maybe I'll bring you back in 6 months or a year and we'll talk again.
Thank you so much. It's been a pleasure. I really appreciate it.